This season, we've been talking about the many ways our country's healthcare system has affected our individual wallets in our Money versus Medicine series. Now, a staggering new study estimates the United States throws away an estimated $800 billion a year on bad healthcare, overpriced procedures, and paperwork mistakes. According to the study, 25% of annual healthcare spending, a complete waste. The number one source of waste was administrative complexity, greater than $250 billion annually. I don't even know what $250 billion is. I just know it's a lot of zeros.
A trillion is 1,000 billion.
Number two, pricing inefficiency. I think all that you have to do is look at the drug pricing scenarios in this country where they're all over the place. 1 year drug costs this amount, the next it costs us like literally 5,000% more. And when you look at this, you know, if you really step back, 18% of the gross domestic product is spent on healthcare. We want to be healthy. And so if we had great healthcare results,
then absolutely.
But we really don't.
No. I mean, you're saying all these huge numbers that we don't even know what they mean. Dr. Ordon does, but we don't even know what they mean.
I'm a math guy, and I don't even know how much money that is. It's too much money.
And meanwhile, you know, you have patients at home that can't buy dinner and their blood pressure medicine.
That's right.
Exactly.
When you talk about overtreatment and overpricing, it's because the incentives in healthcare are to overtreat, are to overtest, are to over-administrate, are to create complexity and obfuscation.
And are to overpay individuals at the top as opposed to putting the dollars where they should be, and that's on patient care.
Well, and I think it also has to do with legal reform. I think there's too many lawsuits in all aspects of healthcare. That's driving the way doctors are practicing medicine too defensively, ordering too many expensive tests. It all goes hand in hand.
Yeah.
It really does. And honestly, there's so much waste. Where do you begin? Well, I would argue at the individual level. When you go talk to your doctor or healthcare provider, ask the question, what alternatives are there? Do I really need this? Well, if I don't, what can I do instead? If you ask those questions, you yourself can decrease some of the wasteful spending that you might be spending on your own healthcare. Look, the one beautiful thing about our healthcare system is this, is I still believe there's no other healthcare system in the world that when true tragedy strikes, there are some remarkable abilities that exist in this healthcare system. But where we struggle is on the fringes with things that we end up wasting our money on without even realizing it. And that's where just transparent conversations with your doctor can save you thousands of dollars potentially each and every year. It's incumbent upon us. Ask the questions. Do I need this? What's it for? Slowly but surely, we may change the tide. $250 billion, Drew. How much do you have?
I have about $1.50 in my pocket.